Health meeting. Today is May 5th. It's also a joint meeting with the Board of Selectmen. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Laws, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Westborough Board of Health and the Board of Selectmen will be conducted by a remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner, using westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we'll post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive recording of proceedings as soon as possible after the meeting. So with that, this is not normally a week that we have a meeting with the Board of Health or with the Board of Selectmen, but in these times we felt it was important that we meet every week just to kind of update the Board of Selectmen, answer any questions, and to be kind of viewed publicly so that we can stay on top of anything that might be coming up. So I think that the one order of business that I had was that Steve has kind of tracks numbers of cases, and I'd like to give him a chance to let the Board of Selectmen know what the current status of things are. So unless there's something else that we want to do before that, I'd like to turn it over to Steve Bakari.
Oh, okay, very good. So since my report on Friday, we've had 35 more cases and 12 new deaths. So brings our death total up to 41 total, and number of cases we're well over 200 now. Anyways, I haven't broken that data out yet, but that's a general summary of where we stand as of today.
Thank you.
Steve, obviously those are relatively shocking numbers in terms of approximately a 20% death rate of the known cases. Of the new deaths, are these all coming from nursing homes, or are some of these coming from the broader community as well? Do you know?
They're all nursing homes, and there's one that's
elderly, right?
Elderly nursing homes, and one that's from a institutional setting. I don't really want to tell you where, because I think people might figure it out. But
sure.
Yep.
But okay, but more or less, the preponderance is still heavily coming from the vulnerable elderly population in nursing homes.
Correct.
Okay.
And not just, I mean, that also reflects, Dr. Ehrlich, correct me if I'm wrong, that also reflects the statewide, that over, I think, and Steve, both you and Dr. Ehrlich, please correct me, over 50 to 60% are institutionalized adults. That the death rate, that's where it's driving the death rate. I'm correct in this, am I not?
To the large extent, the last figure I saw was about 60%, but I haven't looked at the numbers in about a week on that regard, Said.
But I think that the numbers here in Westborough are actually even more skewed toward the elderly than the general numbers of Massachusetts, and that might reflect that we have less cases of people with severe underlying conditions here in Westborough. But I do believe that our numbers are more, even higher than the 60% that you might have seen statewide.
Dr. Ehrlich, this is Lee Emery. Of the 87 that were currently hospitalized when the last report came out, are those mostly the elderly from nursing homes as well?
Correct, Lee. I'll answer that because Dr. Ehrlich may not know where the breakout comes from, but correct. Those are pretty much. There may be 2 or 3 that might have been in the hospital that weren't in the long-term care facilities. But generally, if you're in a long-term care facility, we're considering you hospitalized. There really isn't another category to put those people in. So, and a lot of those people will, even if they recover, won't come out of it.
Right.
they're institutionalized. But as they recover, I've tried to work with the long-term care facilities to take them out of at least out of the hospitalized, maybe move them to recovered category. So at least we have an idea of, who has recovered. I think we still got to work on that a little bit, but again, those people, the vast majority of them are probably, never coming out of that institution anyways. They were there, then they're probably going to stay there.
Thank you.
Dr. Walsh, is it possible if I could make some comments, or did you have something else?
I've got some more general stuff, but feel free to jump in now as an appropriate time.
A couple of things. One, I just, as Steve mentioned the numbers, and some of the other residents had emailed me and reached out to me. It highlights how personal this current tragedy is, and for those people that have shared their loss or the loss of their friends, these are difficult times, and I just wanted to start by acknowledging that that each of the people that we've lost is a universe of loss, and that none of us are alone in this tragedy. The second thing I just wanted to bring up was that I recognize we're going through a crisis right now, so a lot of stuff has been pushed to the margins. But as somebody that's involved in healthcare, I just would encourage people that a lot of things like your screenings for breast cancer, colon cancer, cervical cancer, and your children's immunization, granted those things have been pushed to the margins, but somewhere in your list of things to do, you need to make sure that those things aren't forgotten. So I just would add that. So thank you, Dr. Walsh. That's kind of what I wanted to. Oh, last thing. More importantly, it is National Nursing Day tomorrow, and which is the start of National Nursing Week. And so, now more than ever, our nurses are critical to the fight against COVID. Many of them are struggling with multiple responsibilities, not only just the care of their patients, but the care of their families, the care of their children, and now more than ever, they need our recognition and our protection. So thank you, Dr. Walsh.
In follow-up to that, Steve, I would ask that on behalf of the Board of Health, you express our thanks and gratitude to the school nurses who've been helping you with contact tracing.
Oh, yeah. Every time I talk to them, I remind them of that. They are pretty much saving me right now. So.
Okay, yeah. Well, you say that, but tell them on behalf of the entire board, we truly appreciate them stepping up in the way that they have.
And Dr. Ehrlich, I also talked to Christy about this. So maybe Christy, we may be having a sign on our signboard about National Nursing.
It's actually Sela did that, and it's already up. And she's also added a sign about Teacher Appreciation Week. It's also Teacher Appreciation Week.
Great, thank you.
Good, thank you. We've got lots of staff here in town that do lots of wonderful things for us, and we appreciate all of them. In talking with some people just around town, I've noticed that probably it happens all across the country, but there's a lot of people that are sick and tired of being cooped up, and I want to express to them from the Board of Health that we think that this is still a serious situation. If anything, that the situation is still continuing to get worse. We should not be relaxing restrictions. And in fact, Governor Baker has done similar things where he has increased some of his requirements. In case anyone is not aware, masks in public are required if you can't maintain appropriate social distancing. And even if you are wearing a mask, that does not give you permission to go and hang out, within 6 feet of other people. You should really be maintaining the social distancing at all times. And this problem is still severe and still getting worse. It might have plateaued, but here in Westborough, especially with the death rates that we're seeing and the number of new cases, I want to urge our residents that we still need to be taking this seriously.
So I agree with what you're saying. but I do want to temper it a bit because people will obviously watch the news and see things in other parts of the country and they may have questions. And I think what needs to be understood is that it's a big country and the impact of the disease, the virus, COVID-19, is different in different parts of the country. And we tend to be one of the places, meaning Massachusetts, that has been having its greatest impact relatively later compared to some other places. And it's still persisting at high levels compared to other places. And so, just because you see perhaps other states opening up, that may be fine for them. There may be nothing wrong with that. It may be an appropriate thing for them to be doing. But as has just been mentioned, it's still a problem here in Massachusetts, and within the state of Massachusetts, it's not like we are somehow different from the rest of the state. If anything, we are probably one of the towns being more challenged on a per capita basis.
And last but not least, there's been a report from the Federal Emergency Management Agency. Now, this is not just some random. I mean, these are the people that are supposed to be looking at the numbers that projects about 200,000 new coronavirus cases by the end of the month, and by June 1st, 3,000 deaths per day. So that I hear I get these emails from people and from residents. I understand it is exceedingly frustrating, but recognize that this is a disease that we just found out about 6 months ago. It has taken a huge toll. It's taking a huge toll in our town, and Dr. Fauci actually put it bluntly, but I think he got to the dilemma that all of us are facing. And what he said was, how many deaths and how much suffering are you willing to get back to what you want, to some form of normality sooner rather than later? And those are the stakes that we are dealing with, and it is frustrating to be and I get it. I fully understand it. It's frustrating to be on the, you're trying to do everything right. Your children are trying to do everything right. They're doing social distancing. They are wearing their masks, and you're thinking this should make things better. But you have to realize that this thing has been going on. The spread is still going on. There are other places, that are potentially, remember Florida and other parts of the country did not shut down as quickly as Massachusetts did. They acted as potential transmission pot. There was Mardi Gras in Louisiana. Florida still allowed spring break. All of these states are still opening up. So the question is, will there be further transmission? So I recognize it's frustrating, but it's better to be safe than to be sorry.
Dr. Walsh?
Yes.
This is Lee. I have a couple of things I want to ask about later on, but in relationship to the social distancing and the seriousness of this, my family members, when they're out, drive by the Dairy Queen, and I do too, just to see how things are going at the Dairy Queen at different days. And it varies tremendously. Sometimes, especially over the weekend, the patio has been packed with people, not all wearing masks, maybe 50% of them, and really close together, families with kids. And then other times I drive by, maybe like at lunch today, no one was there. So there's a huge variability in what's going on there, but I'm very concerned about it because of the family interactions, young children, older, grandparents and stuff. And I'm wondering if the Board of Health should be discussing with them how they're managing their clientele. They don't have any spacing painted on their tarmac. They don't have an adult staffer out there trying to manage things at peak times. It's just a bunch of teenage girls, I think, behind the counter whose responsibility shouldn't and can't be to manage this situation. So I wondered what your thoughts are about that.
Yeah, no, my initial thoughts on that are that people should not be dining at restaurants. And so they should not be sitting at the tables at the restaurant because I don't think we've approved them for dining on the premises. Go ahead.
Yeah, they're not eating there. It's simply the lines waiting for people to get served.
So
I see people eating there, Alan.
Oh, you do? I haven't seen that.
Standing with the ice cream cones in their mouths, talking, socializing.
Okay, so we talk to them almost on a weekly basis. It's
Okay.
gotten numerous complaints with them. Erin just texted me that, she does talk to them. They do have signage there. Last I knew, there were taped down markings on the
I didn't see him today.
floor. It's rained a lot, but it's a very tough location. They have signs that one person should be coming up to the window to get the order. If a family of 3 is there and 2 people are standing together, people think they're crowding, but it could be a family while one person goes up to the window. There are no seating there. We had them remove all the seating. It's just a very tough location with a postage size lot in a very popular location. It's just very tough. I don't know.
Well, it sounds like you're trying to deal with it. That's all
we
I
are, but
yep.
we understand the frustration with it. It's maybe we do need to put someone out there, but that's one more person that's out there amongst people that
Right.
and
the
I
other
think that's their responsibility to have somebody out there, not ours.
the other alternative, Steve, is if they can't maintain the social distancing of the people that are going to their restaurant, then we can say that they're not safe to operate, right? And that is something that we could do if they, even if it's that there's, a couple of teenage girls that are the only ones working there, and they've been tasked with the responsibility of the safety of their customers. If they can't do it, then we shouldn't be jeopardizing the citizens of Westborough by letting them operate in an unsafe fashion.
I agree, but remember, they can take one step off the curb and be on town property now. If they sit on the curbing there, they're on town property.
Yeah.
Yeah, and there's a lot to it more than just, it's like I said. Anyways, we can work with them more. We can have a meeting with them. Welcome to any suggestion.
I don't know. So what do you and anyone think about this? And then I think Shelby, you have some comments.
Yeah, I think that I don't recall when I have been there that they have like a, maybe they do or don't, but like a TP sign that clearly says, like at their entrance what the rules are. So that might be a suggestion, something visible. I've seen lots of stores in the, greater Westborough area have signs that clearly set their expectations. So that might be a way. I think it would be a shame to not have that as an option for families, particularly as the weather gets nicer. I think we have to hold each other personally accountable. The governor's orders just came out in effect, today, as Dr. Walsh already said. And so, Lee, I've seen the same thing where they've been, people have been in line, about 50% have masks on, 50% don't. There's not spacing, but at some point, people have to take personal responsibility. And I don't think it behooves anyone to shut a business down that's doing its very best in that setting. Again, it's to Steve's point, it's a very unique setting that I think that's going to cause more problems than it's going to create a benefit.
Alan, do you or Syed have any comments on this?
I would support ongoing monitoring of the situation. I mean, given what I've heard, I've not been downtown all that much, so I may try and just get a sense of it from things, especially after the governor's order takes effect. And so I think this should be something that we discuss at the next meeting. I'm not prepared to take any action tonight. And again, Erin and Ray or Steve can communicate with them, the discussion tonight, and we'll see what actions they take or what actions the people who are in line, what behaviors are changed, and I would be in favor of this being an agenda item next week.
Dr. Walsh, is it possible to have Steve touch base with the school department? I mean, or maybe we should be just sending out another reminder. I raised this up with the board. I mean, maybe it's our fault we're not messaging properly. Maybe we need to do a better job of.
Maybe, but I look at the stores that are doing things well, and I'm thinking like some of the grocery stores and that sort of thing, where they have everything taped out at 6-foot increments. They say stay a shopping cart apart. They basically have, like cones set up near the window to keep people from, getting too close to the window. I mean, they've taken large number of steps, and granted, it's all on their property inside, so it's a little easier to set that up. If it turns out that what's lacking is just they don't have permission to put certain markings down on the sidewalk that's near their location that their customers use, maybe it's something where we can get, permission from the Board of Selectmen or whoever needs to give approval to, put down some tape or some chalk or markings of some kind on those sidewalks to indicate spacing. It seems like as a town and in private businesses, we should be working with them to try to find ways to help keep everyone safe so that everyone can operate. I don't want to shut them down. I don't want people to have to go without businesses that are deemed essential. And even things that aren't deemed essential but are nice to have, I'd like to try to keep as many of those open as possible too. And it just seems crazy that if we don't help them and they feel unable to, set up things because people are stepping off the sidewalk, we need to find a way to make this happen.
Can I we have had several complaints about the Dairy Queen, and the Board of Health is working very hard with them. So I don't want it to seem like there's more that we can do. I mean, I know that Steve sends Aaron out there. I know Steve has had conversations. I mean, I just don't want there to be any sort of thought that the Board of Health is not working as hard as they can to let them stay open and maintain, the social distancing. And so I think that, continue conversations with them. Absolutely. And I know Steve said he's open to suggestions, but they are really doing that work.
Maybe we need to bring him in next week. I don't know what, Alan, your thoughts are, but it might make sense to have somebody who's representing them here that we can really seriously address their. We do this with the Board of Health fairly often. We bring restaurants in that we need to kind of talk to make sure that they're following all the rules properly.
Sounds like a good idea to me.
We just posted the same thing.
I just wrote that in the chat, and maybe it gives them an opportunity for them to speak to the public as well, saying, look, we want to stay open. We want to, we love, that the community is being supportive of this business, but we can't do it without your help. And I think that's also my frustration too. We all have personal responsibility to speak to people who are out in public now without a covering. And to say, are you aware? And that's not an easy conversation to have with a stranger. But, it's one that we should all be taking up in a kind manner.
Yeah, no, well said. I think it's even harder too when it's somebody that you casually know, and that then now it's going to reflect, like you have to go up to someone that you kind of know and say you're doing something wrong. But
that casually known person could be on a ventilator, right? I mean, so I agree with you, Dr. Walsh. It's difficult, but or people need to leave, and then Dairy Queen will respond accordingly.
Yeah, I mean, even if they went as far as saying, no mask, no service or something like that, and turn people away until they go get a mask. I mean, that might help as well.
That's what grocery stores are doing in other places. You don't get in the door without a mask, and there you don't get in line without a mask. I mean, it's work on their part, but I think everything that's been said here makes sense. I think talking to them and letting them know and inviting them into the next meeting makes total sense.
Yeah, so definitely if you hear about places like this, please bring it to the Board of Health's attention. I think that Steve definitely hears about all these things, but the other people that are actually on the board, we sometimes don't hear about all of these issues.
And I guess, do we want a motion that in general, the town would give a business permission to put temporary removable markings on sidewalks or other public property if necessary to help the public maintain social distancing? Because I think of other businesses in town where they might want to do that, where it's a public sidewalk.
I think that would need to have a qualifier that working, in consultation with the town manager, the Board of Health.
I think we could put that on the Board of Selectmen agenda for discussion, though, Christy. What do you think?
Yeah. I mean,
we don't need to have an agenda, right? It's part of our discussion, right? I mean, that's part of
it. Today we're going to ask you to take up something similar related to signage on the Rotary. That's a result of COVID. So, I mean, if you wanted to take that vote tonight, I think you could under the impacts of COVID. But I do think that you don't want to just sort of give that permission without understanding each individual request.
Yeah, I mean, it could be even a case by case where they, you say you can ask the Board of Selectmen or the Department of Public Works or whatever group is appropriate for permission. And then they can evaluate them on a case by case, depending on what the markings are, what the location is. But I think to encourage businesses to seek that, I mean, as far as I'm concerned, the Board of Health, I would advise our companies to go and ask you guys for permission, because I think it would help make things safer.
Yes, I think, Alan, would you be, if you want to make that motion, but I would just say to go through the, town manager, Board of Selectmen office, but basically go through the town manager.
Absolutely. So I move that the Board of Selectmen authorize businesses to request the ability to put temporary markings on public sidewalks or ways as deemed appropriate and necessary to help the public with distancing during the COVID-19 crisis, and that those requests would go through the town manager, Board of Selectmen's office for approval.
I second that motion. Lee Emery.
Any further discussion on that one from the Board of Selectmen?
Mr. Chair, this is Sayed Hashmi. Question for Christy and Steve. Correct me if I'm wrong. Don't we have a stock of masks that we can share with individual businesses? Can we do that? For instance, I'm just thinking, can we give these guys at Dairy Queen, if we have some masks, can we give them some masks to have at their store?
No. Well, we don't have a stockpile, Syed.
Okay.
This should all go away tomorrow. This should all go away tomorrow. Everyone's supposed to have it. It doesn't need to be a mask, a face covering, bandana, whatever works.
Okay.
So hopefully people start to, follow the governor's orders tomorrow, wearing that type of thing out in public. And again, it doesn't have to be a mask; just has to be a face covering. So people should be able to do that somehow if they're out. There's a lot of stuff online how to make your own too, if people Google it.
So also, I think we have a couple agenda items that I think we wanted to get to, and one of them, we sent some stuff around. So one of them is about the task force and our work on making sure that masks are available to people. And so I sent, and I apologize, it was very late today, but I did send over a sort of procedure for distributing masks. We have a lot of people who are creating masks, and they're dropping them off at the senior center. And so the senior center up until now has been distributing those masks, but we have gotten several calls on the COVID information line from people requesting masks. And that was something that we directed people to do on this past Sunday, consistent with the governor's order that's going to affect tomorrow. And so what we would like to do is we would like to have distribution of masks. We would like to take the masks that people drop off. The senior center puts them in individual bags. And what our council and aging director has proposed is that we would have our senior tax work off people who are interested could sit inside the lobby of town hall, and people who wanted to obtain masks could come up to the door, show a piece of paper for the number of masks that they need. The senior worker would go out to the airlock, the vestibule, put the number of masks that they need on the table, go back into the lobby, and then that person could come in and pick the masks up. And so that was one of the things that we wanted to bring before this meeting tonight.
Can I just, Christy, thank you for that. Can I just go back to we had the motion. I just wanted to get that. Yeah. Sorry. Any other discussion on the motion that we had in terms of the public way?
No, sorry, Ian. My apologies.
Nope. Okay, so I'm just going to take a roll call vote for the Board of Selectmen. So Selectman Edinburgh?
Edinburgh, yes.
Selectman Emery?
Emery, yes.
Selectman Marshall?
Marshall, yes.
Selectman Hashmi?
Hashmi, yes.
And Selectman Johnson, yes. So that's unanimous. So perfect. So Christy just gave her thing. So we're on masks. So Dr. Walsh, I'm back to you on that.
So as far as the Board of Health goes, or at least my perspective on it, I think that sounds appropriate. I think that, this would all fall under what I would consider essential business in terms of preparing masks for the public. The ability to actually use the town space, I think, falls outside our purview. So in terms of actually giving permission to actually use that space is not quite us. But in terms of the procedure and looking at the procedure, I don't see anything wrong with it. I'd like to hear Alan and Syed comment on it, though, too.
I agree completely with what you said, that I think it's a good idea, but it's not something that really it falls to us. The permission must come from the Board of Selectmen.
So
the town manager has control of the.
Yeah, so I actually was the one who closed the town buildings. So I think our question more is does our procedure sound appropriate given, guidelines?
Right.
Yes, I do, and I didn't mean, Christy, to imply that you didn't have the authority. I view you and the Board of Selectmen as one entity, and Steve and the Board of Health as the other entity.
Yeah, we do the same way, Dr. Ehrlich. Yeah, I just want to say that there's no vote that the Board of Selectmen needs to do. The town manager has the power to on the building side. So.
One thing that I might recommend is that the door handles that people are using to come in and out and open and close doors, maybe you want some wipes around and periodically be cleaning the door handles. I imagine if you have, 100 people coming through a day to get a mask, and that's a lot of hands touching the door. And so you might want to change the amount of cleaning you do depending on whether it's just one person that came or whether it was 100.
Thank you.
Good point.
And Christy, this is Sayed. I don't know how to say this, but I'll try to say it as politely as possible. I would just, there should be no pressure on the seniors this definitely needs to be volunteers, and it should be volunteers potentially with, that are not immunocompromised or have other significant comorbidities.
Yeah, thank you, Syed. We definitely would only want someone who's comfortable, and we would want to, we would work with the Board of Health to make sure that we were providing people with a mask and gloves.
And I would add that if there aren't enough healthy and suitable volunteers in the senior work program, that we could put out a call. I know that there are high school students, college students who would be more than happy to do something like this and take a shift once a week to help the community.
I think we go to the Dairy Queen and find some of them.
Our task force certainly has a lot of people who are interested in volunteering, so we know we could put that call out. But as of right now, and we know that this is something that they're starting to talk about at the state level, but as of right now, the town has no ability to credit senior tax work-off people without them actually working hours. So we're trying to get creative. But I appreciate what you're saying.
Dr. Nathan, Lee Emery, or Dr. Waltz, rather, while we're still talking about masks, the COVID task force also on their Monday meeting was talking about whether or not we should give instruction on reuse of masks, the surgical masks and the cloth masks. And I guess Alma already has instructions that I think you folks have vetted and think are appropriate for the cloth masks. But I don't think we have any information on reuse of the surgical masks like you can buy, say, at CVS. And if you go online, there's a lot of information. I sent some copy to you about how they could be reused safely if they're isolated for 7 days. So I wondered what your opinion was on giving advice about that or not.
So I'll speak. If you want to jump in, right?
Yeah. So I think the 7 day, set it aside for 7 days. I'd have to see. I read over what you had sent around, and I saw that information there. I didn't see the basis for it. Everything I know says 3 days is sufficient. And typically you want, as I think I may have mentioned at a previous meeting, in some type of like brown paper bag is better than a plastic bag. You don't want to trap moisture. You want things to just dry out. I want to just elaborate on the point of the masks, what they do and what they don't do. And you have to distinguish, I think, two situations. If you have a mask that you're wearing out and about, it's primarily protecting other people from you. If you cough or sneeze, the droplets that you would normally spew don't go anywhere. Or some people, like myself, sometimes when you're animated and you're talking, a little spittle comes out as you are expressing yourself. So it prevents that kind of transmission. Unless you have an N95 mask that has been fitted for you in a very specific procedure, it will not necessarily prevent you from inhaling droplets that other people may have sprayed. And so first of all, that's the main purpose, is to protect. If we all do it, then we're all protecting each other. So it's an exercise a bit in altruism that we all benefit from. But the second thing is, if you are out and about and you haven't come in contact with anyone in a significant way who has been, coughing or sneezing, whatever, if the mask has not been soiled, if you're working with somebody and you haven't, there's some reason to think the mask may have been contaminated, that's a different story than you're just wearing it. You had a normal day, you went outside for a walk, you come back in. I don't think people need to be overly paranoid about, specific procedures about, being very careful about how you touch everything. Again, it depends upon the level of interaction and what your mask has come in contact with in terms of other people's secretions. But if that's fairly minimal, then just take it off, put it in a brown paper bag. If you've got 3 of these, then every third or fourth day you can start reusing them, and that would be my advice. And I think that's consistent with certainly how we understand the COVID-19 surviving on inanimate objects.
So my question then is, do we want to go so far as to give people advice about how to reuse those disposable masks, or does the Board of Health not want to be in a position where they're giving advice that can be misinterpreted? I don't know what your stance on that is.
So I think that the advice that Alan just gave, for instance, a surgical mask or an N95 mask that you already have and that you were treating it in that fashion is appropriate. When you start dealing with like a cloth mask or something like that, something that you might be able to wash, a lot of this is going to depend on the actual how it was manufactured, what it was made out of. We clearly don't want to say that, any mask you have, just throw it into your washing machine at high temp and it's going to be fine, because some of them, will fall apart. Some of them, might need to have special directions on how to do it, especially if you're getting a mask that either you made yourself or that someone else made for you. There might be certain restrictions on how you clean it or treat it that might vary wildly between different masks. But for something that you might buy at a store, something that, might seem more like a surgical mask, something that, looks more like a disposable mask and you're trying to, extend its life, then I think the description that Alan gave is very appropriate. Storing it in a paper bag for a couple of days is going to, be the most appropriate thing to do with it. To say much more, to say that, it maintains a certain % of its lifetime or expectancy, it probably goes beyond the capabilities of what the local Board of Health here can say about any of these masks. But in general, they all seem like good ideas in terms of, how to pursue it. As far as the Alma's masks that she was talking about giving out, I think those are all mostly cloth masks that have been manufactured by people around town. And for those, they, general guidelines around, regular clothing is probably going to be the most appropriate. The same way that you would wash any of your delicates or your, stuff that might have been handmade, you'd probably want to follow for that.
So I guess just to follow on, Dr. Walsh, I think Selectman Emery's question is, do we want to post anything on our website? It sounds like probably not from what you're saying in terms of specifics of not knowing. Is that accurate? Or
you're on mute, Alan, so I think you have to go off mute first.
Yeah, I'm a little reluctant at this point to post stuff because I think the problem is this, that a lot of the information that is out there about how to clean those masks are very appropriate for people in healthcare settings where the chance of the mask being contaminated is much higher than, if someone is just, like I say, going out for a walk or something like that. And you might say, well, if you're in the grocery store where there's a lot of other people, well, that's probably somewhere in between those types of situations. And so because there's a lot of nuance involved, and there's going to be judgments, I'm not sure that we can give advice that is broadly applicable. At least I haven't seen that I would think applies in all such, or covers the range of situations and explains to people what to do. Because what I don't want is people to needlessly panic, and I don't want people to be needlessly overconfident. And it's a tough line to stick to.
You answered my question. Thank you very much.
Sure.
If it's okay, one of the other things that we wanted to bring to you, bring to the Board of Selectmen specifically to vote on is we had a request from a parent group that's working with the high school administration. They would like to place signs on the Rotary for seniors who don't get to experience senior week in the same way, and who, are obviously celebrating this last year of their high school. So for signs to be placed on the Rotary, that needs to be approved by the Board of Selectmen. So it is on the agenda. And so the idea is that they would be working with the high school administration as well as DPW director in terms of putting posts in the ground, and also the police chief in terms of line of sight issues, and myself. But basically, examples that they gave me of what they wanted these signs to say was, we love our seniors, congratulations to the class of 2020. And, we've also talked about a banner. The Board of Selectmen has a banner policy, so that's something that I can approve. But in terms of placing signs on the Rotary, given the circumstances that we're in, we just wanted to bring that to the board.
Yeah, I think up to I'm sure you said Board of Selectmen too, Christy, right?
Yeah.
Yeah, I mean, I'm very supportive of it, but you hit all the points that I was going to bring up in terms of, and most importantly, I think the police chief, safety is of utmost concern. I want to make sure we don't block lines of sight or whatever. So if all DPW, yourself, police chief works with them, I would be comfortable with that. I think it's, again, it's something working with folks and doing it in a safe way is exactly what we want to be doing. So I would be, personally, I'd be for it. I'd look for comments from the other board members.
So I've already talked to, just so you know, I've already talked to the DPW director and police chief. They're very supportive. And I've also talked to the superintendent, who's obviously coordinating a lot of effort in terms of celebrating this class and other milestones. And so she's also supportive.
This is Lee. I think we should do everything that we can to help them with outside demonstrations of support and celebration.
Thank you, Lee.
So I'm fully supportive of this. I had the same concerns, probably, Ian, that you didn't ask. So, but that Christy addressed. I'm curious, Christy, did they consider hanging a banner across the road as that sign of support? My only concern, as I've thought about this agenda item, is that, I worry about the safety and people congregating on the Rotary and taking photos and selfies. And now we're breaking social distancing with or without a mask. And again, you want to believe that people are going to be responsible and kind of recognize it, but it's not a place where you can kind of stop and take a photo. Is there an alternate location, maybe in front of the Forbes Municipal Building versus the Rotary, where we could put them?
We didn't consider the Forbes Municipal Building. We did talk about a banner. They're interested in the banner. My only concern about the banner is that we've talked about, we hang a banner for town elections and town meeting. Mm-hmm. And so sort of the conflict of the timing and all of that, which is why, we talked about potentially doing both. And then if we had to remove the banner, we would still have the signs on the Rotary.
Okay. Yeah, I guess I'm just wondering if the Rotary is the safest place to put the signs. And again, I don't want to get into too much minutia here. How many signs are they going to be all around? I guess I'm wondering if they're doing kind of one big sign or something. I'm wondering if in front of the Forbes Municipal Building is a better, safer place for all this.
So, I think that they're very open. That was my sense in talking to the parent that I talked to. And so you could make the motion sign to be placed on public property, and then we could work with them if you wanted to do that. Certainly happy to have any of you involved in the conversation of where you want it to be located. Like I said, I think they're just, their kids are graduating high school, and they really want to celebrate.
I get it.
Open to
I'm not trying to be a stick in the mud about this. I just don't want to do something in the best of intentions, and then all of a sudden we've got issues and we've got to take it down, and maybe we could have avoided it to begin with.
Sure.
I'm fine with asking. I do think the Rotary throughout my short history, in town, but throughout history, it's a pretty symbolic place, and I think that's why people look for it. It is what it is. People go through that. It's, you see it. it's why I asked the safety question. I think personally, if the DPW is okay, the police chief is okay. I mean, I think I like the idea of the Rotary. To me, it's very symbolic. But to Christy's thing, if they're not, if they're willing to put someplace else that people decide is safer, all for that.
I guess I might amend a motion to offer them an alternative in the discussion. If to Ian's point, if the public safety officials are comfortable with it, then I'm certainly going to be comfortable with it. But let's give them the option so someone didn't say, "Oh, we didn't think about that."
Okay. So, as a suggested motion, I would move to permit signs to be placed on the Rotary or other public property by the Westborough High School parent group working with the high school administration to celebrate the Westborough class of 2020 in consultation with the town manager, Department of Public Works director, and the police chief.
I would second that, Lee Emery.
Any further discussion? Okay, if not, a roll call vote. Selectman Emery?
Emery, yes.
Selectman Hashmi?
Yes.
Selectman Edinburgh?
Edinburgh, yes.
Selectman Marshall?
Yes.
And Selectman Johnson, yes. So 5-0.
Thank you. And I think the only other thing that I had for tonight was Wendy is on the call to talk about the town election.
Hello, Wendy.
Hi, Wendy.
Hi. So I think the last time we left it, we had talked about having the town election on the 13th of June. And I think you thought pushing it out would be better rather than on the 6th. And we had discussed the hours of the election from 10 to 2, and then reduced staffing for the election and having it at Town Hall in Memorial Hall. And so I will be putting out or encouraging people to vote by mail, early vote by mail, and to hopefully reduce the number of people that come to the town hall. I think the governor has allowed that, and the Secretary of State's office, for this only election, because local elections, it hasn't been approved yet to have early voting for it. But because of the epidemic, they're allowing that this time. It may happen, for the future too. I don't know. But I think it's, small, it's uncontested, all the races. I don't see a reason to staff it for the 12 hours. I think, you were right in saying 10 to 2. Those are probably really good hours. Gives us time to get it set up, be able to tabulate and get it done in the afternoon. So I'm just looking for what you guys think, if you've changed your mind. The only other thing I did think about, and I don't know how that would work, is if the town meeting were on the 20th and you wanted to have, if you wanted to push it out, you wanted to have the town election on the Friday before, on the 19th. Be just like a whole town weekend of politics and whatever. So whatever you guys think. I mean, I'm open pretty much to anything but the 27th. So.
Right.
Yeah, I guess listen to the going ahead of the board. I think the big thing to me is, no matter when we have it, is to really push and advertise and request that folks do it through the early voting to limit the number that have to come in, and then likewise, I think working with the Board of Health and whatever, is that when we do have the election, I think we need to be, sure about how we ensure social distancing, just like our stores do and whatever, and that allowing people in and waiting where they need to wait. If we get a large crunch of write-in votes to replace me would be fine. So, But no, I think just making sure ensure that. But I agree with you. I think that at this race, I don't think we expect a huge turnout based on the there being contested. But on the same side, it's an election. We have to allow the democratic process to take place, which means that everyone has to have the ability to vote. So I think, but definitely pushing the early voting. I think pushing it the 13th. I think we talked about the Saturday being a good time to do it, 10 to 2. I'm still supportive of doing it that day.
Okay, that's fine.
I'd like to hear what other board members think. I don't have a final decision. It's the board.
I have a question, Wendy. Would you remind anyone watching this how people request a ballot to mail back to you?
They can call the office. We can mail it out to them, or they can go online. It's not there yet, but they'll be able to download the link and then print it out, fill it out, and mail it to us. They wouldn't have to mail it in or drop it off in the Dropbox.
They can drop it in the Dropbox too. Right? You did that, yeah.
Yeah.
Thank you very much.
Ian, Syed, am I allowed to ask Wendy a tangential question?
How tangential is it? I want to make sure.
You know what, I wanted to find out, Wendy, real quick, do you get the births? Does anybody that's born in town, do you get that information?
Yeah, we get every birth that's any resident that lives in town.
Okay, I'll call you afterwards to discuss that. Thank you.
Okay.
Any comments on the election, Syed?
No, sorry.
This is Nathan Walsh, Chairman of the Board of Health. I think that Ian, you summed it up very well, balancing this democratic process and the health and safety. Trying to choose that road in the middle is exactly what we're doing here. I think that as it's laid out, the 13th still sounds reasonable to me. Syed doesn't really have a comment. I don't know if Alan has a comment. We can ask him, but it sounds very reasonable to keep going with this plan.
I agree with that.
And I'm comfortable with, with the 13th. It does give some time between the election and town meeting, sort of to wrap things up and do the prep work. And hopefully, where we are at that point in time with practical social distancing, physical distancing measures, we'll be able to do it in a way that's safe, not only for the voters, but for town staff, and the poll watchers and the volunteers involved. So.
Okay.
So Wendy, I think anything you need further from the board, or are you good to go now?
No, I think last time, if everybody's agreeable to the 13th, the hours 10 to 2 and having it at town hall, that's great.
Perfect.
I'm sorry. Did you take a vote last time?
No. They were going to wait to vote this time, but that was kind of what everybody was agreeing on.
Okay, so we need a motion then.
Do we want to hold on? Do we want to vote on this? I mean, it's still May 5th, and we're. Yeah.
I think Wendy needs time to get ballots out and things announced and all of that, right, Wendy?
Yes, I need at least 10 days prior to the election for voter registration, and then 20 days notice to give people that the election is happening. So, I be kind of limiting time, and I still have to get things printed and mailed and sent. So
She has to manage her staff too.
Yeah.
Plus, yes. Ian wants to know if he really has to serve another term.
I have to until we vote. So I just need that vote to come up.
I know, right.
I'm just wondering Wendy, suppose the numbers get worse as we head closer. We're still allowed to cancel the election? Am I correct in that?
Well, we'd have to get something from the governor again, or from a judge to postpone the election. We can't just do that. We would have to.
But to that point, Syed, I think there are mechanisms. If we have to, we can do it.
So, do you want a motion?
Oh, sorry.
Yes.
I move that we hold the town election on June 13th from 10 a.m. to 2 p.m. and that we use the Memorial Hall for that purpose.
And can we add a condition
Second.
Can we add a condition that depending on the I don't know how to phrase it, depending on the status of COVID-19 patients or patients.
I don't think we
I
need
don't
to.
think so. I don't think we need to.
No.
Okay.
I think what we're setting for this date, and then if some reason it needs to change, that would be a separate vote.
I second.
Any further comments or questions? Okay, roll call vote. Selectman Emery?
Emery, yes.
Selectman Marshall?
Yes.
Selectman Edinburgh?
Edinburgh, yes.
Selectman Hashmi?
Yes.
Selectman Johnson, yes. Thank you, Wendy.
Thank you.
So I don't think the Board of Health has any more business to do tonight. Does the Board of Selectmen have any other business?
I have one question.
I have a.
Oh, excellent. Okay, go ahead, Alan.
And I have a question after.
I'm sure my question relates to your concern, I hope. So a question, you had, Selectman Emery had sent around a request for some comment regarding oxygen, pulse oxygen meters, and whether these would be, whether the board had any opinion about them. And I wanted to at least weigh in on that question, which is that I don't think they have that much value for what I would describe as ordinary people. We did discuss this. I know Chief Purcell had commented that if anyone is really concerned, they're happy to, they have a kit and they can check. But I think if somebody has poor lung disease, the emphysema or chronic bronchitis, if they are known to have bad asthma or other things of a lung nature that would put them at some increased risk if they were to get sick, then that might be reasonable. And I think, I don't know if it was in the materials you sent around or whatever, but you can find these things online for $50. And if that's not a burden to you financially, then it's fine. But I think for the average person, it probably doesn't make much difference. So, just myself, and I don't own one. If I got one, it's because they're a fun toy to play with, but it's not because I think it's going to protect me in this particular instance, given my own personal medical history. And that's what I'm saying based on that.
Okay. I guess one of the reasons I continue to think about it is because we're beginning to understand that people don't realize how sick they are sometimes. And even the healthcare workers that they may be interacting with say, you're fine, go home and do these things. And that they're beginning to realize if people only knew that they had the silent apnea and that their blood oxygen level is actually diminishing remarkably when they still don't feel short of breath, that if they sought help then, they'd be in better shape. So that's why I keep thinking about it. And, I guess it's something that patients may have to discuss with their own physicians, like how vigilant should I be about my symptoms? And maybe it's the type of advice that's so complex, it's not something that the Board of Health could easily address. But anyway,
when I went through and read those articles that you had sent around and followed up by reading some of the stuff that the people in those articles had talked about, I was not struck with the situation that if a patient were to diagnose themselves as being low oxygen levels and they then went into the hospital early to get treatment early, that treatment is going to be that useful. It didn't sound like there were a lot of case studies where they had people in early and that significantly helped. The other thing I would caution is that those people that are showing up at the hospital and they detect that they have low oxygen saturation at that point in time, they don't necessarily know. They know that those people have gotten bad enough to go to the hospital. What they don't know is how many people might have low oxygen saturation that just goes away on its own as they recover from the disease. And if you now direct all of those people to flood the hospitals because now they're thinking that, oh my God, this disease is going to hit me really hard, and it might not, is that going to create an increased strain on the hospitals that might otherwise not be present? And so I don't know what the outcome would be if everyone had a pulse oximeter and was measuring themselves, and then as soon as the numbers went out of the range, assuming that you could define a range that was normal, with people self-testing, if that would then, really make treatment of care better. And I'm just not sure that I have all the answers to those questions.
I want to. You're on mute, Lee.
You're right. We don't have the answers.
Yeah, I want to follow up though and echo some of the things that you said, which is it is absolutely the case that people can have low oxygen levels and not be short of breath, and it's unclear, as Dr. Walsh has noted, it's unclear what that means. And I know that in some situations, these people are not viewed as necessarily all that sick, although they sometimes are sent home with oxygen from the emergency room. And the thing that is scary to me most about COVID-19 is that when people start to become symptomatic, they can go from being just a little bit symptomatic to very symptomatic and really short of breath and having the pneumonia very quickly. So if someone is diagnosed with the pneumonia, those people can deteriorate very rapidly in a matter of hours in a way that's not typical for other kinds of pneumonia. But it's not clear that low oxygen is a marker for that or not. And that's the challenge. And there's just so much that's unknown about this, even though, as of earlier this afternoon, I was checking the National Library of Medicine website, and there have been almost 10,000 articles about COVID-19 published for a disease that's only been present for a couple months. And yet there's still so much we don't know.
Well, thank you. I just wanted us to consider, is it anything we want to address? And that's fine with me. That's all I wanted. Thank you.
Again, I think you bringing these questions up is very helpful because my attitude is if you have these questions, I'm sure many, many other people who are listening to this have the same questions.
Yeah. Thanks very much.
Thank you, Lee. Thank you, Alan. Well said, both of you.
And Dr. Walsh? Dr. Walsh?
Yes, I am.
Oh, I think Dr. Walsh exited instead of hitting mute.
Yeah. Go ahead.
Well, I just wanted to point out that since we were discussing the pulse ox, I wanted to just at least acknowledge in our board minutes, Paula, the passing of Takuyu Ayogi, who developed the pulse oximeter. He passed recently, and I think this is a man that left an incredible legacy, and the pulse oximeter is not, is really one of the more vital signs that we're following. That we're having this discussion is all because of this man. So I just wanted to bring that to our attention.
Thank you, Shelby. Did you have something?
She does, and I do.
Okay.
Yes, thank you. Appreciate the opportunity to speak. I just wanted to share, you may already be aware of this, but certainly for the public's benefit, that the Westborough COVID-19 Community Fund has been launched. Folks can learn more about that through the town's website. And if you go to the COVID section under community resources, that fund was established to address the current and ongoing needs for individuals who have been disproportionately affected by COVID-19. So donations are now being accepted. And if you have any questions, I'm certainly available to answer those. And we do want to thank the Rotary Club of Westborough for their willingness to step up and administer the fund through their 501c3. Thank you.
Okay. Definitely everyone should donate to that fund. The issue I want to bring up is I've received many emails, phone calls, texts with people questioning if businesses that are open are allowed to be open, and concerns about businesses not potentially following procedures. Probably the two most numerous for me actually haven't been Dairy Queen. One is Tatnick Bookseller. Now I know they have the cafe, so there's a takeout component, but evidently people are telling me the whole bookstore's open. I'm not sure if that's an issue. The other is Cold Harbor Brewing, that they've been open at times for takeout, but that they've had food trucks and people are sitting at the tables eating and not leaving. And so when people come to me with whether or not a business is following the rules as far as a public health issue, I have been directing them to the Board of Health website and saying that I assume that's still the appropriate place to go so that you can determine whether or not they're doing it and whether or not their essential business would be under the state guidelines. document that's on the COVID-19 page of our website.
I just want to add that to what Alan was just saying, that the police department has actually taken note of some of the places that we get a lot of complaints about, and they're patrolling, specifically in parks, as we've heard, but also they're looking for things like that.
So I believe that restaurants are essential, but they should only be doing curbside. So I'm not sure that people should be going inside like Tatnucks and wandering around and, buying books. And so, Steve, maybe you can correct me if I'm wrong, but that was my impression.
It's not curbside. It's still just takeout. You just can't consume on premises. Lots of places have gone curbside on their own, but that's not what the order is. You just can't consume on premises. I'm getting a text from Aaron that we're aware about the food trucks. It's supposed to be to go. I guess if they are using tables, we'll have to address that. I was not aware of that, so we will look into that. I guess the question is, so with the thing where you have businesses that do multiple things, even though we don't have one in town, let's look at Walmart, for instance. Okay, so they're essential for food, but you go in there, you could probably buy toys and all other things. As far as I know, they haven't shut down the whole other parts of the store. If we want to enforce, against Tatnick like that, we probably could. We just haven't. Again, it's a manpower thing. We haven't gotten that specific into some of these stores. So
it's not just Walmart. Target is the same way, and so my feeling is, yes, in those stores, perhaps a greater proportion of what they sell falls under the essential business exclusion, but it's not exclusive. And the general approach, I believe, in this state has been, if you have some part of your store open, people are allowed to shop in any part of the store. And I feel like unless there's somebody's going in and observing that there's really a problem at Tatnuck, I'm not inclined to make an exception of them compared to everybody else.
So I don't know exactly how it works at Tatnuck, and so maybe someone can correct me. But if it doesn't matter what register you go to, like you can pick up your coffee and a book and you can go to any register, then that would imply that, yeah, you could pick up a book and a coffee at the same time. If you have to buy your coffee over at, one end of the store in the restaurant area, and you can only buy your books at the other register at a different part of the store, that would imply that they really are two separate things and that you shouldn't be doing both. And so that would be kind of the logic that I would look to apply, is that if you're, because like if I go to, Stop and Shop and I buy a book at Stop and Shop from their aisle there, I can bring it up to any register and ring it out. But if there was like a separate section that was just for, coffee and food, and it was like a separate business, then I would see that we shouldn't be allowing the other business to operate just because they co-locate.
I think that's a reasonable thing, and maybe somebody can stop by Tatnick and have a conversation with them.
Yep, we'll do that.
All right.
Okay.
A scenario I hadn't even thought of. I mean, I guess Target and Walmart both have big food sections too.
Yes, they do.
From the little restaurants, yeah, and a lot of people go there.
Yeah, and I mean, some of the stuff they sell, they also sell toilet paper that's not a food item, but we all need toilet paper, so it's not that all of these places are banned from doing anything besides food, but I don't think that booksellers fall on the list of essential businesses.
Both Walmart and Target also have pharmaceuticals that they sell.
Yep. Good. Is there any other business?
I make a motion that the Board of Health adjourn.
Do we have a second?
I'll second that. Sayed Hashmi.
Okay, we'll do a roll call. Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Actually, before I do that, do we have to pick a date? Are we meeting next week?
I would say yes.
Yeah, my sense is it probably makes sense at least to meet until the governor's next order as of May 18th expires. And we should have a good sense of where things are going at that point, and then we can decide if this is still necessary.
Okay, I didn't know if we had to formally just make that motion each time.
Yeah.
I think we already had it on there, and we have the regular Board of Selectmen's meeting next Tuesday, so we can.
Good, excellent. Okay, then Dr. Walsh is a yes, and so our meeting is adjourned. Do you guys want to do the same thing?
Is there a motion to adjourn this Board of Selectmen meeting?
I'll make that motion.
And
Second.
Lee Emery second it. Okay. Alan.
Roll call vote. Selectman Emery.
Yes, I say yes, and I do want to thank the Board of Health for being so courteous and willing to answer the questions that I've brought up.
Selectman Edinburgh.
Edinburgh, yes, and thank you, Westborough TV, for the broadcast.
Selectman Marshall.
Yes.
Selectman Hashmi.
Yes, and don't forget it's National Nurses Week starting next week. So let's make sure we celebrate our nurses and teachers.
Selectman Johnson, yes, and Selectmen's meeting adjourned. Thank you, everybody.
Good night, everybody.
Bye, everyone.